All right, ready to dive into this world of anti-infective drugs.
Oh, I'm ready. It's such a fascinating area.
Our listener wants to understand how these medications work against viruses, bacteria, fungi, all these tiny invaders.
And we've got this nursing school lecture on anti-infective drugs to guide us. It's pretty detailed.
Perfect. To break it down, we're focusing on three main categories: antivirals, antitubercular drugs, and antifungals.
Starting with viruses. Those tricky things. Not even technically alive,
Right, just little packages of genetic material.
Hijacking our cells to replicate.
Yeah.
Sneaky little things.
Kind of unsettling when you think about it.
It is, and that's why antivirals have to be so strategic, so they don't harm our own cells in the process.
The lecture talks about all the ways viruses can enter the body, like inhalation, ingestion, even through the placenta.
It really highlights how important a strong immune system is, right?
Absolutely. And vaccines, like giving our immune system a heads up.
Exactly. Like a wanted poster, so it knows what to fight.
This lecture includes a table of common viral illnesses. Some have an asterisk, meaning they can be controlled by drugs.
Not a cure, but a way to manage them.
Right. So how do antiviral medications actually work? There are so many different viruses out there.
Well, you can think of it as a three-pronged attack. Some prevent the virus from even entering our cells, like blocking the door.
That makes sense. What are the other two prongs?
Others target the enzymes that viruses need to replicate, basically cutting off their power supply.
So the virus can't copy itself.
Exactly. And the third prong disrupts the replication process itself, throwing a wrench into the machinery.
Clever. But the lecture says antivirals can't destroy a virus that's already inside an infected cell.
That's why timing is so crucial with antiviral treatment. The earlier, the better.
Makes sense. Okay, let's get specific. The herpes viridae family sounds intimidating.
Most people know them as HSV1 and HSV2. Cold sores and genital herpes, those are the common culprits.
Right, everyone's dealt with those at some point.
And don't forget HHV3, the one that causes chickenpox, and then can come back later in life as shingles.
Shingles, yeah, I've heard those outbreaks are incredibly painful.
They can be. The lecture really stresses the importance of the Shingrix vaccine for adults to prevent them.
Prevention is key, I hear that a lot. So no cure for these herpes viruses, but
we have medications to manage them.
like acyclovir and valacyclovir help control those outbreaks.
Exactly. And make life a bit more comfortable for those dealing with these viruses.
Definitely. But herpes is just one piece of the viral puzzle, right?
So many others. Cytomegalovirus, CMV, that's often treated with ganciclovir.
What about the flu? Influenza A and B. Everyone gets that at some point.
For the flu, we've got oseltamivir, you might notice Tamiflu, and Zanamivir is another out.
Tamiflu, yeah, I've heard of that.
But timing is key with those. Starting treatment within 2 days of symptoms is crucial.
Don't wait too long to see the doctor then. What about hepatitis? There's A, B, and C, right?
You got it. And the good news is we have vaccines for Hep A and B. But hepatitis C is trickier.
No vaccine for that one.
Not yet. Treatment involves a combination of antivirals. It's tailored to each patient.
Complex stuff. Now let's talk about HIV. A lot of weight to that one.
HIV attacks the immune system, leaving people vulnerable to other infections.
I know it's transmitted through bodily fluids, but what's the risk for healthcare workers? Needle sticks, things like that.
The lecture mentions it's actually quite low, around 0.3%, which surprised me.
That is low. Guess those universal precautions really work.
They do, but treating HIV, that's another story.
Yeah, it's a lifelong thing. Right.
It is. And it's complex, individualized, usually a combination of drugs, and it needs to be adjusted over time.
The lecture emphasizes the importance of taking those medications as prescribed.
Absolutely. Skipping doses can lead to drug resistance. Makes the virus much harder to control.
So adherence is key. Okay, we've covered viruses. Now on to bacteria. TB, to be specific.
TB is caused by Mycobacterium tuberculosis. An aerobic bacterium needs oxygen to survive.
So that's why it usually hangs out in the lungs, right? Lots of oxygen there.
Exactly. It spreads through tiny droplets when someone coughs or sneezes.
Like a cold or the flu.
Similar, yeah. But here's the thing with TB. It can become dormant in the body.
So just hiding out, waiting to reactivate.
Exactly. And that's why it can be so tough to get rid of. Plus, there's the issue of drug resistance.
Multi-drug resistant TB. Yeah, the lecture mentioned that. Scary stuff.
It is, especially in vulnerable populations.
So how do we even begin to fight TB?
First, we need to figure out the specific strain causing the infection. Drug sensitivity testing is key.
In a personalized battle plan.
You got it. Treatment usually involves a combination of antibiotics.
How many?
Usually 2 to 4 for the first 2 months. Then isoniazid and rifampin for another 6 to 9 months, sometimes even 12.
Wow, that's a long treatment.
It is, but it's necessary to completely wipe out those bacteria. The lecture then goes into detail about some of the key medications.
Let's hear about them. Isoniazid, that was first on the list.
Isoniazid, or INH, inhibits the synthesis of the bacterial cell wall.
So the bacteria can't build its defenses?
Exactly.
Huh.
But there's a side effect. INH can also mess with vitamin B6 absorption, which can lead to nerve damage.
Nerve damage, that's serious.
It can be.
Oh.
So people taking INH often need vitamin B6 supplements.
To counteract that side effect.
Exactly. Another important drug is rifampin, which inhibits RNA synthesis.
So it stops the bacteria from making proteins it needs to survive.
Right. But it has a strange side effect. Turns bodily fluids reddish-orange.
Like orange tears. That's bizarre.
It can be a bit startling, yeah. It also interacts with other medications like birth control pills.
So many things to consider. What else is there?
Pyrazinamide, it lowers the pH inside the bacteria, making it hard for them to survive.
Sounds like a hostile takeover. Any downsides?
It can worsen gout symptoms.
Oh, wow. So it could help one condition but worsen another.
That's why understanding a patient's full medical history is crucial. The last one is ethambutol, also disrupts the bacterial cell wall.
Anything notable about this one?
It carries a risk of vision problems, so regular eye exams are necessary.
Makes sense. Okay, so we've tackled bacteria. What about fungi?
Fungi, they're a diverse bunch, from single-celled yeasts to multicellular molds.
And some are good, some are bad, right?
Exactly. Some are part of our normal flora, while others can cause infections, from athlete's foot to more serious systemic infections.
Yeah, those can be pretty dangerous, especially for people with weakened immune systems.
Absolutely. The lecture classifies them into 4 main types: cutaneous, subcutaneous, superficial, and systemic.
Cutaneous, like athlete's foot, right?
We got it. Subcutaneous is below the skin, superficial is just the surface, and systemic, those are the ones that get into the bloodstream.
Scary stuff. What about candida? I know that's a common one.
Candida albicans, that's the culprit behind thrush and vaginal yeast infections.
I've heard those yeast infections are common after taking antibiotics.
That's right. Antibiotics can mess with the balance of bacteria, allowing candida to overgrow.
So how do we fight these fungal infections? Antifungal medications, I presume.
You presume correctly.
Yeah.
There are a few different classes. Polyines, those work by basically poking holes in the fungal cell membrane.
So they destroy the fungi.
Exactly. Amphotericin B and nystatin are in that category.
And then we've got azozoles, right? Imidazoles and triazoles.
Yep. Those inhibit enzymes needed for the fungal cell membrane, so the fungi can't build that protective layer.
Makes sense. And the last class.
The echinocandins, they prevent the synthesis of glucans, which are essential for the fungal cell wall.
So we've got a whole arsenal of antifungal weapons,
Mhm.
but each drug has its own strengths and weaknesses, right?
Absolutely. Nystatin, that's a common one for candida infections, thrush, skin infections, vaginal yeast infections.
And it's safe to use during pregnancy and while breastfeeding, right?
That's right, which is a big plus.
Oh.
But nystatin is mainly used topically. For serious systemic infections, we might need amphotericin B.
That was the one with the scary side effects, wasn't it?
Shake and bake syndrome, they call it. Fever, chills, shaking.
Doesn't sound fun.
Not at all. They usually give pre-medications to try to prevent that. Thankfully, there are other options, like the azoles. Fluconazole, that's a common one.
I've heard of that for yeast infections.
That's one of its uses, and sometimes it can be a single dose, which is convenient.
Definitely. Okay, before we move on, let's talk about nursing care and patient education.
It's crucial. Nurses need to check for allergies, underlying conditions, potential drug interactions.
Right, lots to consider before starting someone on these medications, and then monitoring for side effects, too.
Absolutely, especially for those who are immunocompromised, and educating patients about the importance of completing the full course of treatment.
Even if they start feeling better before they finish all the pills.
Exactly. That's how resistance develops. And depending on the medication, there might be specific instructions. Like for nystatin, you have to swish it in your mouth for 2 minutes before swallowing.
Makes sense. Well, we've covered a lot of ground already. Antivirals, antituberculars, antifungals.
It's a complex field, but fascinating. And nurses play a vital role in all of it.
Welcome back to our deep dive. We're getting into some of the challenges with each drug class now. Antivirals, antituberculars, antifungals. It feels like we've only just scratched the surface.
Oh, there's so much more to explore. And as we get into it, you'll see how these challenges, they really impact patient care. It all connects.
Okay, so let's start with antivirals. What really stands out to you as a major concern with this class?
Well, viruses themselves, they're tricky. They mutate so quickly. It's a challenge to keep up.
Makes developing effective treatments difficult, right?
Exactly. We develop a new drug, and the virus figures out a way around it. It's a constant race.
So even when we have effective treatments, we can't get complacent.
Nope, not at all. Ongoing research is crucial, and the patient's role is huge EE.
Adherence to the treatment plan, especially with something like HIV.
You got it. Missing even a few doses can give the virus a chance to come back stronger, and that's where resistance develops.
So it's not just about taking the medication, it's about taking it consistently, correctly.
Exactly. Nurses play a big role here, educating patients about adherence, explaining why it's so important, addressing any concerns they might have, side effects or anything like that.
Empowering the patient. But beyond adherence, are there other things that make antiviral therapy complicated?
Absolutely. Knowing when to use a specific drug is key.
Mm.
Understanding the indications, the contraindications, it's not a one-size-fits-all situation.
Each antiviral has its own, rule book.
You could say that. Some are safe during pregnancy, others aren't.
Right, that's a huge factor to consider. And drug interactions, too.
Big time. Antivirals can interact with other medications, reduce their effectiveness, or even cause dangerous side effects.
So many things to think about.
It's like a puzzle, making sure all the pieces fit together safely. And, of course, monitoring for those side effects is critical.
We talked about ganciclovir earlier, how it can affect bone marrow function. That's serious.
It is. Regular blood tests are a must with that one, making sure the benefits outweigh the risks.
Close monitoring seems to be a common thread here.
You're catching on. It's a balancing act, targeting the pathogen without harming the patient.
Right. Okay, let's switch gears to anti-tubercular drugs. What are some of the unique challenges with TB treatment?
One of the biggest is the length of therapy. We talked about it before. It can last months, sometimes even a year or more. It's a long haul for everyone involved.
Yeah, I can imagine it's tough for patients to stay motivated with such a long treatment plan.
It's a real challenge. Side effects, forgetting to take pills, just getting tired of the whole routine, it happens.
And that's where nurses come in again, right? Providing support, encouragement.
Absolutely. Checking in regularly, answering questions, celebrating those milestones, helping patients see that finish line.
Like a marathon, you need those cheerleaders along the way.
Exactly. Another challenge with TB is drug resistance. We mentioned multi-drug resistant TB earlier, and it's a growing concern.
So preventing resistance is paramount.
It is. Starting with the right combination of drugs from the beginning is essential. And of course, educating patients about taking those medications exactly as prescribed. No skipping doses.
What about side effects? With such a long treatment, I imagine those are a big consideration.
They are. Some of these drugs can be tough on the liver and kidneys.
So regular blood tests are a must there too.
Yep. And monitoring for any neurological side effects is important. Numbness, tingling, weakness, things like that.
I remember you saying isoniazid can mess with vitamin B6, which can lead to nerve damage. It's a reminder that even medications meant to help can sometimes have unintended consequences.
That's the truth. And drug interactions, too, those are always a concern. Rifampin, for example, interacts with a bunch of other meds.
So the takeaway here is lots to consider with TB treatment. Length of therapy, drug resistance, side effects, drug interactions. What about antifungal medications? What unique challenges do we face there?
Well, toxicity is a big one, especially with some of the older drugs, amphotericin B, for example.
Shake and bake syndrome, right? That didn't sound pleasant.
It's not. Even with pre-medications, some people still have those reactions, and it can be tough on the kidneys. Close monitoring is crucial.
Are the newer antifungals, like the echinocandins, any better?
Generally, yes. But they can still have side effects, and they're more expensive. Always trade-offs to consider.
It seems like that's a recurring theme here. What else makes antifungal therapy challenging?
Diagnosis can be tricky. The symptoms of a fungal infection are often vague. They can mimic other conditions.
So healthcare providers need to be really alert, especially when dealing with immunocompromised patients.
Absolutely. And once you've diagnosed a fungal infection, you need to figure out the specific species causing it. That's how you choose the right medication.
Okay, makes sense. Now, I remember the lecture mentioning opportunistic infections. What are those exactly?
Think of it this way. There are organisms that wouldn't usually cause problems in a healthy person. But when the immune system is weak, they can take advantage and cause infection.
So the immune system is like the body's defense, and when it's down, these opportunistic invaders can sneak in.
Perfect analogy.
Yeah.
And these infections are a serious problem for people with HIV, cancer, or other conditions that suppress the immune system.
And if I'm remembering correctly, even anti-infective drugs themselves can sometimes increase the risk of these opportunistic infections.
You are remembering correctly. By suppressing one pathogen, we might accidentally create an opening for others. It's a delicate balance.
So we're trying to fight one infection without opening the door for others? Tricky.
Very tricky. That's why nurses need to be on high alert, watching for any sign of these opportunistic infections. Fever, chills, anything unusual.
Early detection is key, as always.
Absolutely. And sometimes we even use prophylactic treatment with anti-infective drugs to prevent those infections from happening in the first place.
So it's like a chess game, always thinking a few steps ahead.
You got it.
Yeah.
And just like chess, there's no one right move every time. We have to constantly reassess and adjust our approach.
Welcome back for the final part of our deep dive. We've really gotten into the nitty-gritty of these anti-infective drugs, how they work, their quirks, the safety dance we have to do. But now, let's zoom out, look at the bigger picture. The lecture kind of hints at this looming issue that affects all these drug categories we've talked about.
The elephant in the room, you could say, and it's a big one. It could really jeopardize our entire arsenal of these medications.
You're talking about antimicrobial resistance, right? I hear it everywhere these days, but honestly, I'm not sure I fully get what it means.
Well, think of it this way. It's basically when the microbes, the bacteria, viruses, fungi, they start developing ways to resist the drugs we use against them.
So the drugs become ineffective.
Exactly. And it's happening across the board. Antibiotics, antivirals, antifungals, you name it. We're seeing it everywhere, and it's getting worse. It's like a global health crisis unfolding.
The lecture mentioned multi-drug resistant TB. That sounded pretty scary.
Oh, it is. And it's not just TB. We're seeing resistance to everything. It's like the microbes are waging war, and they're getting smarter.
So what's causing this resistance? Why is it happening now?
Well, there are a few things. One big one is overuse and misuse of antimicrobials. Like prescribing antibiotics for a viral infection, they won't do anything there.
Oh, I've definitely been guilty of that. You go to the doctor with a cold and beg for antibiotics, even though you know they won't help. It's like we just want a quick fix.
It's natural to want to feel better fast. But taking antibiotics when you don't need them, it just adds to the problem. It helps those resistant bacteria thrive.
And what about agriculture? I've heard that plays a role too.
It's a huge factor. The majority of antibiotics produced worldwide, they're actually used in livestock, not humans.
Really? I had no idea.
It's true. And often, they're not even used to treat infections. They're used to make animals grow faster. It's a big problem.
So we're basically breeding resistant bacteria and then they can jump to humans.
That's the gist of it, yeah. But here's the thing. We can all be part of the solution, too.
Okay, I was hoping you'd say that. But what can we do? It seems so huge. Like, how can one person make a difference?
Well, start with being aware of your own antimicrobial use. Only take them when absolutely necessary. And finish the entire course, even if you start feeling better before you're done.
No more begging for antibiotics for a cold. Got it. Anything else?
Talk about it. Tell your friends, your family. The more people understand the problem, the better. Education is key here. We need a real shift in how we think about these medications. They're not just quick fixes, they're precious resources.
Right, they're not something to take lightly. But I know it takes more than just individual actions to really tackle a global problem like this. What's being done on a larger scale?
Well, one big hurdle is there aren't many new antimicrobial drugs being developed.
Yeah.
It's not as profitable for drug companies as, say, drugs for chronic conditions.
Yeah.
So the pipeline's drying up.
So we're facing a potential shortage of new weapons in this fight.
That's the worry. We need to find ways to encourage the development of new anti-infective drugs. It's crucial. And we also need to be exploring alternative approaches, things that don't rely on traditional antibiotics or antivirals.
Like what?
Well, there's phage therapy, which uses viruses to target bacteria. It's pretty cool, actually.
So we're fighting fire with fire. That's amazing. What else is out there?
Scientists are working on all sorts of things. Nanoparticles, antimicrobial peptides, you name it. It's a really exciting time to be in healthcare. We're on the cusp of some major breakthroughs, but it's also a bit scary, you know? This resistance problem is a serious threat.
Definitely a balancing act. Hope and concern all mixed together.
That's a good way to put it. But I am optimistic. I think if we work together, if we're smart about how we use these medications, if we keep pushing for new solutions, we can get ahead of this.
I like that cautious optimism. Well, this has been a wild ride. From those tiny microbes to this huge global issue, we've learned so much about anti-infective drugs, how they work, their limitations, and the vital role nurses play in all of it.
It really highlights how interconnected everything is, right? Individual actions, public health policies, scientific advancements, it all comes together.
Absolutely. So, what's the takeaway message for our listener today? What do we want them to remember?
I think the most important thing is to be informed. Learn about these microbes, these medications. The more you know, the better equipped you are to protect yourself and those around you.
Knowledge is power, right?
Absolutely. Well, thanks for joining us on this deep dive into the fascinating and sometimes a little frightening world of anti-infective drugs. We've covered a lot of ground, but hopefully you found it helpful.
We'll be back soon with another deep dive into a new topic. Until then, stay curious, stay informed, and stay healthy.